Now I request uh, Dr. Himika Gupta to speak on preschool eye screening using Bruckner's reflex visibility study.
Good afternoon, respected judges. I'm basically an ocular oncologist with a special interest in community ophthalmology. I'm a lecturer at MGM Medical College, Lissa, and this work was done along with the NGO. So we have a lot of kids in India. Every fifth child born on this planet is Indian, and 1/3 of these are under 5 years of age. Childhood blindness is mostly preventable and correctable and contributes to significant DALYs, that is, disability adjusted life years, because of the age. What are we doing for childhood blindness in our country? The NPCB caters to the school eye screening program, which targets the 5 to 15 years old, more based on the ophthalmic assistance. So what happens to kids below 5? In India, currently, there's an absence of any eye screening protocol. They are considered difficult to locate, uncooperative, very few tertiary level centers, and basically a financial burden. But not all kids reach school, and those with severe visual impairment, bad finances, developmental delays are the ones who really need the vision screening, and they actually don't reach school to benefit from the school screening program. What does the West say? The APOS recommends at least 4 red reflex examinations up to the age of 5. Though the Bruckner's test is used a lot all across the West and West countries, in India, hardly any pediatrician uses the red reflex test. So with these things in mind, we went ahead to look at the preschoolers because we wanted to catch them early and simultaneously sensitize the parents and caretakers, do a sibling screening, and pick up potentially life-threatening diseases like retinoblastoma or brain tumor. So the aim of the study was to know the feasibility of screening the preverbal kids using the simple Bruckner's red reflex test with the direct ophthalmoscope. The steps of Bruckner's we all are familiar with. We generally do it in a semi-dark room at 50 centimeters or 1 meter and look for equality of the red reflex or the pupils. Any asymmetry or absence of the red reflex or any kind of confusion or suspicious red reflex was warranted to have an ophthalmic referral. We did it in 4 modules, that is 2 in the urban slums of Govandi in Mumbai suburbs and 2 in the Khopoli area, which is a rural area. So model 1 was preschool in urban slums. Model 2 was the urban health center itself in urban slums. Model 3 was the immunization OPD of the rural hospital at Khopoli. And model 4 was an Anganwadi of the Khopoli rural area. So these are the tests. We basically looked at a 9-month period and we had 298 kids. What we found was in the immunization model, we had almost 40% of abnormal Bruckner's who needed a reference. In rest all of the groups, roughly 20 to 30% had abnormal Bruckner's. This is a busy table, but basically discusses all the results. So we can look at the lower half of the table. Here we will see that the average time taken per child was almost less than a minute to maximum 3 minutes. So in the health center model, it was under a minute. Also, in the immunization model, maximum kids, that is 42%, actually had abnormal Bruckner's reflex. The follow-up amongst those declared abnormal was highest in the health center model. We had our own challenges. We thought that having pre-registered lists was a good idea, but it was a bad one because the spellings, the pet names, the house names, they all never matched. Then the manpower involved in trying to channelize the people was important, and the follow-up schedules. So to conclude, 4 different approaches to execute the Bruckner's screening test in preschoolers was employed. Although a single day community screening, like in one day you just make them all sit in one place and screen, was very time efficient, 0.74 minutes per child. But the opportunistic screening using the Universal Immunization Program OPD was having the maximum yield. So right now the road ahead, we are continuing this project and expanding it as a part of the NGO in rural and urban Maharashtra as well as Uttarakhand. We use the waiting time for health education. We've included Hirschberg's and cover-uncover test. But most importantly, we want to now push the government, if possible, to include Bruckner's testing as a part of the universal immunization program. In fact, as a part of the National Retinoblastoma Task Force, we all have been putting up this proposal, and let's see what happens next. Thank you so much for a patient listening.
Very important topic. I remember Professor Prem Prakash used to say that if a patient comes with retinal detachment, we are so much worried. And if a child comes with amblyopia, we think that it's all gone. And we don't treat them, and we do not do any screening for the children to do this. And this is a very good test which can be used for.
Yes.
Dilate the pupil?
So we used a semi-dark room because as per the rules, legally it's not possible to instill drops without a prior consent. So when we need it, then the consent is taken and we call them for a dilated evaluation.
To get a good reflex, you should dilate the pupil. Otherwise, it's very difficult to get, because the small children, they will have a very small pupil.
Correct.
And they will not be cooperative so much.
Yes. So those cases were called back again in the universal immunization group, and if still the pupils were small, then we dilated them with consent and rechecked the reflex.
Okay. Thank you very much.
Just a minute.